Hi, and welcome to Journey Forward with Jory Rose, where you will gain insights, tools, and inspiration to get unstuck and live your best life. Jory is a licensed marriage and family therapist with a passion for helping people cultivate awareness and authenticity so they can show up fully in all aspects of their life. And now, here's Jory.
Hey everyone, and welcome back to Journey Forward with Jory Rose. I am so happy to have my guest on today, Brandi Moore. Brandi, welcome to the podcast.
Thank you.
And please go ahead and introduce yourself and tell our listeners who you are, what it is that you do, and what is it that you're really passionate about bringing into the world and the work that you're doing.
Awesome. Yeah. So I am a naturopathic doctor and hormone expert. I have been in private practice for years now, and I really enjoy restoring my patients' hormone health because we don't realize how many things our hormones actually control. They control our metabolism, our weight, our mood, our energy, our brain functioning, right? It controls everything. Typically, we think hormones, we think muscles, and maybe periods, but there's so much beyond that. And so I really like shedding light on those conversations and topics with my patients and with clients and with anyone who follows me on my many internet pursuits. And so I just like spreading awareness about the effects that our hormones have on our general health and how we can optimize those hormones and optimize our wellness.
Oh, I'm so excited this conversation is happening right now. It feels so timely for so many reasons. I know you and I were chit-chatting a little bit before we hit record, and there's so much going on in the world right now with people needing to figure out, how do I get to my best health? And yes. I had shared with you that I am overcoming COVID, that I was positive a couple of weeks ago, but now I'm experiencing some symptoms that I'm assuming is COVID related, and really figuring out, what can I do from the inside out? You know, what can I do beyond what I might think of how to treat things when, you know, I don't know what the cause of what's going on in my body. And so it's gotten me thinking a little bit more naturally than perhaps I personally ever have. And so I'm personally excited for this conversation, just because I think there's so much that we make assumptions around with our health and our bodies. There's probably a lot of really misinformation out there that people don't understand. So I'm really thrilled that you're here. So can you just give, I mean, you listed off a couple of things, but I was writing them down as you were saying, so I want to go back to these things and ask about. So maybe start from like a really basic level. Okay. Of understanding of what actually are the hormones in our body, because when I think of hormones, I usually think of teenagers going through puberty.
Fair.
Right. And we have all these changes happening, and we know that hormones are going to affect their moods. And we're like, oh, well, tough luck. It's just their hormones. Nothing we can do about it. We just got to get through that hard period of life.
Yep.
And, you know, in fact, this is a funny aside, but I think you'll appreciate, there used to be this kids show years ago. And at the moment, I'm forgetting the name, but it'll come to me. So it's the brain fog that I'm having since COVID. But it was kind of like sketch comedy for kids.
Was it all that? Because I used to love that show.
No, it wasn't that one. It was a different one. And they had this one little sketch where it was like some hormonal, awful, like pimple-faced, irritable teenager. And they basically like had the kid on a bed in a sleeping bag where they zipped up, like it looked like a corpse bag, where we're like, okay, we're going to like just water you, and we're just going to keep you over here until you like get through your puberty. And like years go by, and they unzip the bag, and the kid emerges like clean faced and all happy and kind and, you know, nice to the parents. And it was like, how to deal with your hormonal teenager.
Yeah, that's hilarious. Put them in a chrysalis. They shall emerge a butterfly. I love that.
So again, I think it's easy for people to think about hormones as related to puberty, but we know that they affect us our entire life. So I'm going to let you now say, what exactly is this hormonal business that we are dealing with our entire lives?
Yeah. So there are many hormones that do many things, from thyroid hormones to our sex hormones, hormones that control metabolism and all of those things. But the basic sex hormones, which are the hormones that rage in puberty, are the same hormones that sustain us throughout our life, right? So for women, it's everything from menarche, or the start of their menstruation, all the way to menopause and kind of beyond, because once those hormones drop at menopause, you start to see an increased risk for things like osteoporosis, cardiovascular disease in the female population. Because we're losing muscle mass with the decline in hormones. We are losing estrogen, which is one of the hormones I'll talk about in a second, that helps to give us that plump, youthful glow. It helps with things like libido. It helps with vaginal dryness. And those are some of the things that you see once you hit menopause kind of take a decline. It also helps with cognition. So the hormones, although the pimply teen is who we think of, those hormones actually don't go away, and they fluctuate throughout life's changes until we hit menopause in women. And in men, same. They have the same hormones at different levels until they hit what's called andropause, which is the male version of menopause.
I've never heard that word.
Yeah. Yes.
Andropause.
Yes. Because in menopause obviously refers to like a pause on the menses, right? Like stopping the menses, whereas men don't have that, but they do have androgens. And so their sex hormones are referred to as androgens, and they decrease once they hit about age 30 is when a man's testosterone starts to decrease until he hits about andropause. And then he gets different symptoms to a woman, but still has some symptomatology around the same time, those 50s, like late 40s, early 50s.
Yeah.
Throughout. So in men and young boys and teens, the dominant hormone is testosterone. Now they still have estrogen and progesterone. They just have them at much, much, much lower degrees than we need them. And testosterone is like their primary. It's also responsible in the womb for differentiating the difference between what will be a boy versus a girl. It helps in puberty, once you hit those secondary sex hormone, sex characteristics like breasts and pubic hair and things like that, testosterone is the primary one responsible in boys and teens. And then in women, so I mentioned 3 hormones and I didn't tell you any of them. So testosterone is the primary one in males. And then they also have estrogen and progesterone. In women, our primaries would be estrogen being kind of the main one, along with progesterone, and then testosterone being our second or tertiary one. We need it.
Which is so interesting, because I bet most women don't acknowledge or realize that they even have testosterone.
Correct. So, because often we talk about estrogen and progesterone, but women need testosterone too. It does some of the same things that it does in men, but again, it's like reversed. So the amount of testosterone that we need is much lower, just like the amount of estrogen that they need is much lower, and their progesterone as well.
Right.
So those things just fluctuate. And, in a woman, you have birth or like pregnancy. And if you decide to have a baby, postpartum, right? You're always going through those fluctuations. So every time you get pregnant, so from pregnancy to postpartum to breastfeeding, all of the hormones work in concert to allow these things to happen throughout your life until you hit menopause. But the hormones literally affects everything. And that's just the sex hormones. You have thyroid hormone there's multiples that also control your metabolism, your mood, your energy, your brain function, right? A lot of people notice brain fog. Hot and cold intolerance. It helps to control your temperature regulation. So thyroid hormone and then adrenal hormones. The main one we tend to think of is cortisol, which is our main stress hormone. So there are lots of different hormones, all working in concert to do a lot of different things. And one that we don't often think about is insulin, right? Insulin gets blood sugar in the blood into the cell so that we can use it or store it for energy. So all types of different hormones, and they all work together to kind of have you be a functioning human.
So the fascinating thing about it, and, in the work I do in mental health and as a therapist is, we're looking at emotions and behaviors and stress levels and traumas and all of the things that affect our mood and our ability to, as we all know, right, be present, be in healthy relationship. And when we look at mood, it's easy to look at environmental factors. Are you in a stressful environment? Have you had enough sleep? What is, your kind of organic tendencies, maybe perhaps any, traumas earlier in your life. But how often might we want to consider hormones in mood? And if we realize our mood is off, like, how do you even determine what might that hormone imbalance be? And therefore, what do I do about it if I'm recognizing I'm doing therapy, I'm practicing mindfulness, I'm meditating? How else can I regulate hormones? Or like, I guess even a bigger question is there a baseline way of understanding what our hormone balance is so we know what needs attending to?
Yeah. So the easiest way to know on an individual basis is labs. That might be urine collection, where we can look at the metabolites and kind of what you're doing with your hormones. The other option is a blood test. So from an individual perspective, that's the easiest, fastest way to find out, are my hormones imbalanced and could it be causing the issue? Now, certain hormones like your insulin, most doctors, PCPs, whether they're into hormones or not, are testing your blood sugar control, which would show us, is insulin working? And then if it's not, they'll go and they can actually test your insulin. Thyroid health, most doctors do like a screening. So it's typically what's called a TSH with reflex. It just looks at one of the markers though. So I don't like to use it for my full thyroid assessment to see if that's an issue. But a lot of doctors will do that as a screening to see, is that something we need to address or not? And that's usually in your yearly labs. So if you're getting those done, there is someone who's taking a peek into your hormone health, at least the general ones. When it comes to sex hormones, some of it will show in the symptoms, what the imbalance is, and it looks different for men than women. So in men, we often think of too much testosterone being like a roid rage, being that like super, I mean this in the least offensive way, but like that meathead that you think about, that gym guy, super buff, only cares about how he looks, like you injecting steroids. Mm-hmm. That's not what we're talking about.
Kind of the hyper masculine image. Correct. You would get.
Correct. Like the word meathead, whatever you envision, is what we tend to think of when we think of taking testosterone. But testosterone is necessary in every man at every age. And you don't have to take it to the level of roid rage. So if it's too high, that's what you might notice is like aggression. If it's too low in a man, he'll feel blah is the easiest way for me to explain it. Yeah. So drive,
that's the medical term. Blah.
That's the medical term. That is, I paid a lot of money to learn that term and then tell people about it. But in general, he feels like a muted version of himself, right? So that energy he had feels muted. He feels like he doesn't have as much energy. He feels like he's operating in a bit of a brain fog. Mm-hmm. He also might notice that when I used to go to the gym, I used to, get things done. The same workout routine I'm doing now with the same diet changes would have ended in these results. He's noticing less muscle mass. He might notice more depression, right? Maybe more anxiety because of the lack of testosterone. And so it goes beyond kind of like that big buff guy you think of at the gym injecting roids in the locker room. It's like, you need that hormone. Now, do you need anabolic steroids? No, but prescribed from a physician can really make a difference in how they feel, because it is like a muted version of themselves. They'll say, men describe things a lot differently than women. Anytime I had a man come in, I knew that his appointment was going to be super short, right? Because I asked the question, it's yes or no. It's just fix me. And then I would have his wife come in and it would be like twice as long, way more.
Let me tell you, every example, this has shown up. I remember the date. I remember what I was wearing. The kids got really angry that night because dad was pissed.
Exactly. And so whenever I have those male patients come in, it's just like, it's going to be super short. And he'll be like, yeah, I don't know. I just feel off. I'm like, okay. He's like, yeah, the energy is low, mood is low, libido is low. That's also common. There might be some erectile dysfunction. And so you kind of figure out what's going on in the symptoms and then run a lab. I never really replace hormones without knowing where the hormones lie.
Right.
If it's low, which often it is, then I will go ahead and give replacement. But a lot of that, like, even if you just think of being a lesser version of yourself, that is depressing. Like, I used to be able to run a marathon. I used to be able to have energy to play with my kids. I used to want to have sex with my partner and everything worked the way it's supposed to. If all of those things changed, that would be very hard to cope with, having to do with that change and feeling like less of a man or less of who you were.
So I have a question on that. So it's easy to help give more testosterone to someone who is experiencing all those symptoms if they have low testosterone, which does decrease with age, right? So just like with women decreasing estrogen, their testosterone is going to decrease with age. Is there a way of regulating when someone is having too much testosterone and it's causing hyper masculinity of being more quick to rage or aggressive, kind of, can you turn down the dial on a meathead?
That's a great question. For a naturally occurring situation, that doesn't happen often. The body knows what it's doing. Like if he's being a jerk, he's probably just being a jerk, unless he's taking something. So you have to find the root cause. So are they taking something that they got at the gym? Are they taking something that a friend gave them? Because that happens more often than not. And it doesn't have to be the meathead that you're thinking of. It could be that accountant, and you would never suspect that he was on some type of steroid. So always there's typically a reason. And so it's finding the reason why the testosterone's too high and then having them stop that behavior. There are herbs that we can do, but I have never lowered testosterone in a man because they need it a lot. More often than not, they come in and it's way too low, even from a young age. Like it doesn't, oftentimes andropause is in those late 40s and 50s, but it can also happen in a 20-something-year-old male, especially with the increased use of marijuana or medical marijuana, because that does suppress testosterone or boost estrogen. Also, a diet high in processed foods will also cause that. Non-organic meats, those meats contain hormones, things like soy and other phytoestrogens, which are plant-based estrogens, can act as estrogen in a man. And so it can lead to kind of lowering testosterone-like symptoms. You would have to have a lot of soy, like you'd have to be eating a ton of tofu to have that reaction, but all in concert, right? If you had someone who was doing all of those things.
Right. So that's interesting. Constant use of marijuana can decrease testosterone.
Yes. And obviously in states like California, where you are, and Colorado, where I am, it's legalized for recreation and medicinal use. And so when you're 17, 16, 18, 21, 25, you're not thinking about future fertility. You're not thinking about your masculinity. You're just living in the moment. But what if the reason why you are unmotivated isn't just the marijuana, it's the effect that it's having on your testosterone?
Right. So fascinating. Mm-hmm. Oh gosh, there's so many different areas. Okay, so we covered kind of the male side of it. I believe most of our listeners are women. So let's delve into what do women need to know? And then ultimately not just, what are the results of it, but what can we really do from it in both things that we can do organically, maybe like lifestyle changes. Mm-hmm. And I do want to eventually get back to talking about stress and how we can manage that. Because that's something that you and I think, we could spend hours, on our shared information around can do. But so you gave all of that description really beautifully and clear. So thank you for that on the male side of the testosterone. So let's switch it to the female side.
Yes. So in females, our balance, it requires a little more finessing. I always
We're special.
we are. Whereas for when I was in medical school, our urology class, it's like men's health is jammed in urology. So you're learning about like the male anatomy, but you're also learning about the bladder and the urethra and the kidneys all kind of at the same time. Whereas women's health or gynecology, we had at least 4 or 5 different classes. We had labs dedicated just to gynecology. So men kind of get shoved because their anatomy is a little more simple compared to the complexities of the female anatomy and hormone picture. So with women, as a recap, we have estrogen, progesterone, and testosterone. We need all three. We need all three to be at optimal or peak levels. And when they're not, you can get a whole host of symptoms. One of the main ones when it comes to mood would be anxiety, depression. You can see that's kind of a common thing when it comes to these hormones. Brain fog is another thing that can happen when these hormones are off. You can have aggression if your testosterone's too high. You will see that in women. What you'll notice typically before that, though, is male pattern hair growth. So lip, chin, kind of beard area. You'll notice that they will get facial hair. Cystic acne is also a sign in women that their testosterone is potentially too high. Now in women, we kind of have, I would say, names for things, but if your testosterone is too high in a woman, typically she'll be diagnosed with PCOS or polycystic ovarian syndrome, which comes with a whole host of other things. Because usually it's high testosterone and then kind of suppressed progesterone and estrogen. So that person, fertility might be an issue. And anytime there's an imbalance in those hormones, fertility is at risk. Which sometimes women are like, oh, I didn't want a period anyways. And I'm like, you have no idea what that period's actually telling you. It tells you a lot about your health. I know it's annoying, but you want it. And there's ways to make it less annoying. But so the period will be affected, fertility will be affected, energy is affected. I kind of mentioned the mood things that are most common, which are depression and anxiety.
Right.
And then weight is affected when those are off. Typically it'll be weight gain, especially with estrogen dominance. So that's another thing that has a name because we often see it in women. So PCOS, estrogen dominance, the way that estrogen dominance can present can be endometriosis. It can be fibroids. It might be cysts. So it's kind of a wide picture for women, and there has to be a little more investigating, figuring out what symptoms are you having, and then matching that with what's the hormone that could be imbalanced.
It's amazing anyone stays alive.
Yeah, it is.
Can function.
It's so
There's
true.
like the circuitry of networks and, cells and systems. Like it's fascinating. And
yes,
there's so many different avenues to look at the body, right?
Yes. And there's the kind of, we're just talking about one system too, right?
Right.
And we're not even
Exactly.
talking about like the depth of that one system. We're not even talking like cardiovascular health, brain health. How is your digestive system working? Like even those things will affect your hormone health and vice versa. So like hormones can affect brain functioning, for instance, right? But brain function can also affect the hormones if there's something off. Then your brain isn't sending the signals to tell your body to make the hormones.
Right.
So stress also plays a huge role when it comes to affecting these hormones. Stress, I feel like in high school, whenever you get your period and it's like, oh, I'm so stressed, my period's going to be late, right? That's typically what we think. What tends to happen is stress will shut down your reproductive system. Now you still might get a period when you're really stressed. It's not to say that won't happen, but 9 times out of 10, you probably won't be ovulating and your period can be off because what happens is cortisol, which is that main stress hormone I mentioned, it will need help. So it will take your progesterone, which I mentioned being one of the main female hormones, and it will convert it to cortisol. So instead of you using that for lady reasons, you're now using it to manage your stress. And it almost like shuts down the system that's supposed to be there, which can look like periods that become shorter and shorter, meaning the whole cycle from day 1 to day 1 typically is like 28 days. You might notice that it's 28 days, then it's 26 days, then it's 24 days, then it's 25 days. Like it can shorten your cycle, which is
so that's like an interesting way for women to kind of check how their stress is affecting them.
Correct.
Because they may not think of things like that, but that would be an interesting little root marker. Oh, wow. I know. And obviously this is for women who are not any sort of birth control that is affecting their hormones, right? So we got to have that subset of population that's not affecting.
Yes. So you
naturally occurring periods or not.
Yes. You cannot be on hormonal birth control. You could be on like a copper IUD because that doesn't affect your hormones. And so that wouldn't change. Or like recently they came out with another non-hormonal one called Phexxi. So you could be on that and not have anything dealing with your hormones or messing with your hormones.
I had that copper IUD once. Yeah. That thing was awful. I hated that.
It is. I teach a class that I'm actually bringing back called the Birth Control Breakdown, where I go through all of the birth control options because I feel like you often get prescribed whatever your physician is used to prescribing, whatever they like to prescribe. So if they like prescribing IUDs, IUDs for everyone. If they like the pill, then everyone gets the pill. And often it's not an open dialogue about what's your lifestyle like, what works best for you, what are your fertility goals in the future. There's not an open conversation. So I like to open that conversation, give women the education, and then do what you will with it. If you still want to take hormonal birth control, go for it. But at least you have all of the information versus just like kind of being handed a script and being like, okay, I guess I'll take it.
Well, I ended up with it. I think this is interesting information for women to understand. I'm also curious, what went on there, but I ended up, after having my second daughter, and I had C-sections.
Yep.
After having my second daughter, I was in recovery and from the surgery, and I experienced the most biggest painful surge of a headache I've ever experienced in my life. And I turned to the nurse and I said, I think my head's about to explode.
Oh, no.
And she checked my blood pressure and it had shot up to 220 over 110.
Yeah.
And she immediately administered a blood pressure medication into my IV. But for a couple of days, none of the doctors knew what was wrong with me. I kept getting these spikes of blood pressure, which was resulting in these massive headaches. They put me on Percocet, which was like, there was a blood pressure issue. It wasn't a pain issue.
Yeah.
So I found out that I ended up having postpartum preeclampsia. So my OB team didn't really know what that was. It was really my general practitioner who had diagnosed it as a blood pressure issue. But I had to be on blood pressure meds for 4 months it took 4 months until my blood pressure regulated on its own. But as a result, I couldn't go back on the pill because of the hormones.
Yep.
So I ended up with the copper IUD and hated every second of that for a variety of reasons, from both like the heaviest periods that I've ever experienced in my life. I literally thought, like, how am I still alive?
Yeah.
Like, the amount of blood that is coming out of my body, like, where is this all coming from? And not to mention, it was poorly inserted, and my husband at the time could feel it during sex. It was like all around a terrible experience. So once my hormones got regulated, and it started coming out one time, and my doctor had to it was awful. Yeah. So that was my personal experience, but it was a result of me not being able to be on any hormones.
Yes. So here's the thing. When I teach it's a free webinar, but when I teach it, there is no perfect birth control. It's unless abstinence, right? Then you're giving up something. So there's really not anything that's going to be 100%. You have to know the benefits and risks and then make the decision that's best for you. So after my second baby, who was a beautiful surprise baby, we decided to go on birth control. I cannot be on hormonal birth control because it triggered migraines. And I like the whole reason why I even came up with the birth control breakdown webinar in the first place was because I realized that there's not a lot of education for women when it comes to this. And there's not a lot of education about when you should stop it, when you should talk to your doctor. Like, yes, we're all given the little pamphlet from the pharmacist, but who reads those? No one. I would love for one person to DM me on Instagram and be like, I actually read the whole packet, because I bet no one has. So when I started getting
it's a humongous packet when you unfold that little piece of paper, and the writing is so small.
So
it's really not inspiring you to read. If they had a picture book version,
you need can you just give me a 3-minute video? Because you could probably wrap it up in 3 minutes.
Yeah.
A magnifying glass with your prescription. So no one reads those. And so when I was prescribed hormonal birth control in college, I was on the pill because, again, that's you get typically what your doctor likes to prescribe. And it was like, it's the lowest dose of estrogen, so it shouldn't be a problem. Great. Take it within the first few weeks, the week before the breakthrough bleed, which is what it is on the pill. It's not actually a period. But I got my first migraine in life. And I was like, what is this? Where is this coming from? I've never had one. I was an hour away from home. I had to drive home with a migraine. Got home, covers overhead. I was like, that was weird. Okay, next month, same thing, same time. The next month, same thing, same time. So this happened for months. And then finally my mom was like, do you think it could be I don't know if you're on birth control, but maybe that's what it is. And so I looked into it and I was like, wow, I think that is what it is. I stopped it immediately. The migraines went away. I started again in medical school because I'm like, okay, maybe it was just a fluke. Who knows? Told the nurse practitioner what was going on. She goes, I think you needed a higher dose of estrogen. So we'll roll with that. But we'll start low this time and kind of work our way up. But my assumption is your estrogen needs to be higher. Okay, fine. Start the pill. Things are dandy. The week before my period's supposed to start again, migraine. And I was like, cool, I can't take this. So it just so happens that at that time I was sitting in pharmacology and we were talking about birth control. And one of the things is if you have migraines on hormonal birth control, it puts you at risk for having a stroke. So you need to not take it. But I reported this to a nurse practitioner, right? I told this to a doctor. No one had anything to say. No one was like, that's a red flag. You should probably stop, or you should do something else. And so I was like, wow, I didn't even know I was putting my life at risk. I was doing what everyone does, right? So you assume, okay, I might gain a little weight. Okay, it might cause this, but most women don't know that hormonal birth control can cause low libido. So there
kind of defeats the purpose now, doesn't it?
There you go. So there's a lot on there.
I don't care about getting pregnant if I don't want to have sex anyways.
Correct.
Which I wonder how many women who kind of, and I've worked with women for years. I don't mean to cut you off, but I think that's a really interesting thing for women to look at the different areas of what could be causing low libido. Because I know so many women, friends and clients who are like, I could give or take sex.
Yep. Stress and potentially a birth control. And if your hormones are off. So that could be testosterone being too low. That could be estrogen being too low. That could be issues with progesterone. I say stress, we don't give it as much credit as it deserves, because if you just had to if you had a terrible day at work and you came home and your kids were just being wild, right? And then your husband is also not helping or whatever, like you're probably not going to feel like having sex, and that's okay. I also think sometimes we compare ourselves to other people. So I had a patient and she was like, well, I know I should be having sex 3 times a week. And I was like, well, who told you that? She's like, well, I know I should, like, shouldn't you? And I'm like, I don't know. Do you want to? Like,
right.
Are you stressed? Are you in the mood? Is he revving up the engine? Is he warming up the car before he just tries to drive it? Like,
do you guys get into arguments that you don't resolve?
Right. There you go. Like, there's not a one size fits all when it comes to sex, but the cadence that you like. So usually if I ask the libido question, it's from that perspective, not from like, you should be doing it 3 times a week. How dare you? It's kind of like, all right, what pre-kids, pre-marriage, when it was just you living life, what was your libido scale of 1 to 10? Or like, what was your preferred cadence? And they were like, oh, I was at least 5 times a week. Okay, cool. When did that change? And then is it stress? Was that with the same partner or with a different partner? Is your partner pleasing you? Like, you kind of have to parse through what is going on.
Yep.
Because it's so mental. People don't realize how mental sex is.
Oh my gosh. When I remember being in couples therapy towards the end of my marriage, and I think this was the first time I'd really heard this therapist had said, for women, their brain is their biggest sex organ.
Yeah. It's
and
so true.
There's a book that I have that I would love to interview the author. The book is titled Better Sex Through Mindfulness.
Mm-hmm.
And it's this idea of, especially for women, part of it is our maternal instinct that we are like thinking about and taking care and nurturing everybody at all the times. Like our peripheral vision on like our caretaking mindset is always extended much beyond, men can really just kind of be a little bit more tunnel visioned in their overall mindset and such. But women, we are so detached from our own bodies, and we are so stressed that we don't even recognize it as stress.
Yes, true.
And so to be more mindful, to get more attuned into the body. And in that book, they did a study where they asserted like a vaginal, basically like a vibrator with some detection on the end of it that could detect, I think, vaginal wetness or blood flow. And they had women watch like pornography and ask the woman, is this turning you on? The women were like, nope, not at all. But their body was responding that it was. Yeah. And it's just so interesting. We're not even tuning into the cues that our body is giving us when our stress and our mindset and our, all the other issues are getting in the way of even tuning into what naturally our body's wanting to do.
Yes, it's true. And so one of the things that I recommend is mindfulness, but mindfulness in whatever moment that you are, right? Like coming back to the present moment, which yoga very much taught me that. I was like, oh, I never really even knew that concept existed, but it's almost like narrating what's happening. It's like, oh, he touched me there. Did I like it? Yes, I do actually like that. How does that feel? How does that and trying to narrate it in your mind. Because as I think an undiagnosed ADHD survivor is what we're going to call it, my brain wanders, and my husband will be like, how can you be thinking about other things? I'm like, I could think about 20 billion other things while that is going on. And that's obviously a problem. So I could be thinking about, oh, what are we going to have for dinner, or the kids, or breakfast, or I need to make sure I go grocery shopping. It's this to-do list of things. And the way that I can quiet my mind is to have that narration until it gets to the point where I don't need to narrate it anymore. And like, okay, I'm in the present moment.
Yeah. So, I mean, again, I think we could talk for hours about so many of these different things. So when people notice, the symptoms of a hormone imbalance, what do you recommend? What are the best organic ways? I know there's obviously, medical interventions, but what are things that people can do on their own in their day-to-day life to just help the health of their hormones?
Yeah. So in general, move your body any way you see fit. One of the things that a lot of my clients have to realize is that HIIT or CrossFit is not always the best way for that, or the best means for that, because stress is stress. Good stress, which is eustress, or distress, which is bad stress. It's all stress. So my body doesn't know that I want to be in a bikini by my birthday in April. All it knows is that I'm doing CrossFit 6 days a week. I'm not sleeping enough and I'm not eating enough. And so it's like, oh, survival mode, cortisol will increase, and then it knocks my hormones off of balance. And so often those high achieving, stressed out women who are there's a meme I always refer to, which is there's this dog whose house is on fire and it's standing in front of the house with a smile. And it's just like, everything's fine. There's nothing wrong. Like, that's a lot of women. We're like, the world could be breaking around us, but we have to be so strong for everyone else. And so we don't even address what's going on. So for those ladies, I do not recommend high intensity interval training or CrossFit or Orange Theory or anything like that more than twice a week, because it really does, it increase our already high cortisol. It just can't handle it because it's just increasing our cortisol. And I tell my patients that
so I'm clear with the connection. And so as our listeners, when the cortisol increases, it decreases the other hormones.
Progesterone. Yes. It decreases progesterone, which will create what seems like an imbalance to your body. So your body is always trying to hit this perfect level of estrogen and progesterone. And these hormones fluctuate throughout the cycle. So the first half of the cycle, estrogen is the dominant one. It builds the uterine lining. It basically creates a beautiful uterus environment for a baby to grow and an egg to implant. Then we ovulate in the middle of our cycle, so around day 14. And then the second half of our cycle is controlled by progesterone. So progesterone's job is to maintain that lining, hopefully maintain that pregnancy. And then when the body realizes, oh, we didn't get pregnant, you shed your lining. That's your period. That thickened wall with all the blood vessels, that's why we bleeds out. So it's always this concert of these two hormones. And estrogen dominance can look like, in a patient, weight gain, again, anxiety or depression, kind of depending on what they're dealing with. It can also look like uterine fibroids, which I mentioned, heavy periods with lots of bleeding without the copper IUD to be the thing that we can blame it on, because that lining is getting really thick. So it can cause heavy bleeding, painful cramps. It's been linked to, now there's no specific cause for endometriosis, but estrogen dominance will worsen that picture, because that uterine lining that tends to grow outside of the uterus will grow in an estrogen dominant medium. Things like breast, uterine, and ovarian cancer are more common in an estrogen dominant situation because it needs estrogen for those cancers to grow. So we definitely don't want to mess around with estrogen dominance. And that could be estrogen being frankly too high or progesterone being too low. If progesterone's too low, it looks like, even if estrogen's normal, that estrogen is then the dominant hormone.
Because it's changed the ratio almost, right?
Correct. Yes.
So you said, so the connection there, so the cortisol decreases progesterone.
Correct. So cortisol will take progesterone to make more cortisol. So then your symptoms will appear as estrogen dominance. So you might notice the weight gain, you might notice issues with your hair or acne or any of those things that are typical in that estrogen dominant picture. Now, if you have fibroids or endometriosis, then you're already naturally a more estrogen dominant person. So imagine lowering that progesterone even more. It makes those other symptoms even more blaring and problematic. So the high intensity training increases cortisol in a good way, but you're so stressed out that it doesn't.
You don't want to do it too much.
Correct. So limiting it to at least twice a week. Move your body the other days doing bar, yoga, Pilates, pick walking. Pick a lower impact, a lower intensity exercise.
Because what you're saying here is, I think, so valuable to differentiate, because normally when we think of stress, we think of mental or emotional stress, but what you're also saying is stress on the body.
Correct. And your body will not parse out, oh, is that I'm working out, that's good for my body and it's good for my mental health. It'll say, wow, I'm already super stressed here, and then now I'm extra stressed. A great example that I use for my own life is I was a resident after medical school. I was a first year resident. I had gotten engaged. So I was planning a wedding, and who doesn't want to look good for their wedding, right? Like that's pretty common. So I started doing Orange Theory, and I worked my way up to doing it like 5 or 6 times a week. And the closer my wedding got, because that's the longer, I did it about 6 months before my wedding, my periods just started getting closer and closer and closer together. That's why I also recommend that women track their cycles on an app, a calendar, something. And so I was able to notice that, like, oh yeah, it started off maybe at like 27 days. I've never been a 28 dayer really. So it was like 27 days, 26, 25, 24, 23. And I'm like, that's abnormal. And when I tested my progesterone, it was low. And I was like, wow, everything I tell my patients, I'm now experiencing.
It actually happened.
Correct.
So because of that, is it true? Because, I've often thought this anecdotally, but this gives some of that medical background to help understand the more stressed you are, the more likely you are or susceptible you might be to like breast cancer.
Well, yeah, it puts you in an estrogen dominant state. Yeah. Mm-hmm. So anything that puts you in an estrogen dominant state for an extended period of time will do that. Now, also there's a question of susceptibility, right? So typically if you have a family history, was it, your mom, your sister, your aunt, that also.
Right. The psychosocial bio,
correct.
Kind of looking
so
at all of that.
If you kind of say, okay, super stressed out for a long period of time, family history of breast cancer, it might put you more at risk. And then obviously nowadays you
add your stress levels on there. Yeah.
Yeah.
Oh, it's so fascinating. Okay. So we said move your body. So
yes.
What else would you recommend?
Move your body often, decreasing stress, which is also part of it. So whether it's journaling, meditation, mindfulness, deep breathing, something.
Come work with me.
There you go. Get in where you fit in. Go on your journey with Jory. And really kind of tweak the stress, because that will have a cascading effect. And it affects more than just hormones, right? Cardiovascular health, when we talk about things like heart attacks and whatnot. Addressing the diet. So a diet low in processed food, low in sugar. It doesn't mean you can't have fun. You have to find the balance that works for you, but food will affect your hormones, especially non-organic meats, things like pesticides will all have an effect. And sometimes it's what's the word I'm looking for? It's a hormone dysregulator, which is not quite the word I'm looking for, but even when we talk about diet, lifestyle as well. So chemicals that will also cause dysregulation to the hormones, like phthalates, plastics, things like that, can affect your hormone health. These are all things that can be changes over time, right? It doesn't have to be overnight, but it can all affect your hormones from a big picture perspective, especially if you're super stressed out, if you're heating lots of things in plastic and eating them. And if you don't have an outlet for your working out, you're not moving, you're not eating right. Like they all work together to kind of bring that picture.
So with the diet piece, obviously it's pretty easy to say, decrease processed foods and sugars. And that's pretty easy to go for. When it comes to the organic foods, you mentioned organic meats, because that can be a major additive cost to our food bills if now we're like getting organic everything.
Yes.
So if you're going to go organic with food, but don't want to like double your food bills, because sometimes that organic things really are that much more expensive and we have to take into balance everything.
Yep.
What would be the best thing? So you mentioned meat a lot, but because those animals are given growth hormones, right?
Correct.
So is it not so much like the pesticides on the fruit?
I tell people,
or is it? So what would you say to that? Yeah.
everything in moderation and do what you can and can't afford. So say you right now, you can't afford organic because it doubles your grocery bill and you don't have it in the budget, then eat as healthfully as possible with the budget that you have. So that might mean non-organic meats, but that's better than a bunch of processed foods. So think like hot dogs, burgers, fast food, things like that. It's better that you have non-organic chicken or non-organic, whatever fish, whatever you're into. Same with the vegetables. Now, if you have more fluidity, obviously you can kind of revamp everything, but meat's kind of more important in the hormone conversation than vegetables and fruits. With those things also, if they have a peel, not as important, right? So especially if it's hard. So think avocados, not as important to get organic avocados because they kind of have a harder outer shell.
Bananas.
An apple, because you're eating the apple or eating the skin typically. Bananas, other hard shelled or shelled kind of fruits and vegetables. No need
like
to get those
citrus fruits, right? Because you're not going to eat the peels. Yeah,
correct. You're going to peel, and that's the thing that gets sprayed the most. So less important. When it comes to things like rice or condiments, or, my mom, love you, mom, if you listen to this, but she's like, oh yeah, I bought these organic cookies. And I'm just like, what? Like, just, if you're going to have a cookie, just have a cookie. But like, I would rather you use that organic money on the base of what you should be eating. Cause at the end of the day, that's still sugar and it's still a lot of other things. So yes, be realistic with yourself and kind of go for the big hitters, which I would say would be like dairy and meat as your first thing, if you can't afford to go organic, and then fruits and vegetables as you find the ability. Also growing
and eggs.
Yes. Eggs, I would say eggs, dairy, and meat being the main things. Eggs, especially because the nutrition is in the yolk. And when you get that like golden colored yolk, it means that chicken had a really great varied diet and it's healthier than if you get a really pale yolk. So even paying attention to when I buy eggs from this place, I get these really like faint colored yolks, organic or not organic, compared to when I get them from Sprouts or when I get them from Whole Foods or somewhere else.
Brandi, such good information. Is there anything we didn't touch on?
No, I feel like
people. Okay, good. I'm like, okay. I felt like we got so much in, but I'm like, I hope we didn't like miss an entire area. This was such helpful information. And, one of the things that I've been saying a lot since the pandemic is now more than ever, we need to make sure that we're counting our mental and emotional health as equal as a component as our physical health when we look at taking care of ourselves. And, I believe this more so than ever. And it's the thing that I don't think people realize they have that much power and control over. And they can really, a lot of these lifestyle changes aren't hard. And they're not things that we also don't always talk about in general about what it means to be healthy. But creating a conversation where, to me, healthy isn't just, are you eating right? Are you exercising? Are you getting enough sleep as the basic or, basic forms of health, but really opening up the door to say, what does it really mean to be at my optimal levels of health?
Yeah. And sometimes you don't know because you've never been there. Right. So some of us have lived very stressful, traumatic lives from a mental, emotional perspective. From a perspective on health, we've never noticed it, never eaten a vegetable. Like you just don't know what you don't know until you figure it out. So I always recommend baby steps. Don't get overwhelmed, right? Find someone that you like to talk to, work on the mental health while you work on the physical, because it helps going into diet and exercise. And by diet, I don't mean like a crash diet. I just mean changing to a more healthful diet. Going into that hating your body or hating where you're at or trying to only change something is very detrimental to your success. Go into it because, I exercised today and I noticed I slept better. I had more energy. My mood was more stable. I wasn't as volatile, right? My kids did the same thing they always do. And I didn't want to like throw the kitchen sink. Like I was good. It
makes such a difference. Yeah.
Yes. So like focusing on how you felt as a whole person and not just did my jean size get smaller, which is especially this time of year, what everyone tends to care about. You'll have those stick because you'll work out or you'll eat healthfully for one day and be like, wow, I felt really good. Then the next day you might have pizza. And then you're like, well, I enjoyed the pizza. I enjoyed it for the first 2 slices. And then I realized like it was kind of diminishing returns. And then I kind of felt like crap. Okay, cool. That's more information to take it into how you live the next day. Maybe the next day you had pizza, but you only had 2 slices and a salad and you felt great. Like
Right.
using other data points other than the scale when trying to make healthy changes is key.
It's such a huge mindset. I'm someone, I've struggled with weight majority of my life. And from my highest to my lowest, I lost over 70 pounds. And
Wow.
I have gained some back, but reasonably so. And but still from where I am now to my highest, it's still 45, 50 pounds difference.
Mm-hmm.
So I've never gone back up. But I notice, like, even right now, I'm really, really eating clean and healthy, and I'm doing an anti-inflammatory diet to deal with any of the COVID related longer symptoms that I've been experiencing. And going into the mindset of eating healthy to treat any COVID related symptoms so I can maintain my health is so much easier to make that healthy food choice than because I want to lose 5 pounds because I'm going to Hawaii in a couple of months and I want to feel better, because I can easily be like, oh, I'll do that tomorrow. I'll start again tomorrow, or I'll start Monday, or this one thing won't make a difference. But having the mindset of, no, like, I'm making this food choice because I actually want to be healthy. Mm-hmm. At least just this week for me. And I've done this different times before in different ways, but it's a noticeable, tangible difference in how I engage with my relationship to the food I'm eating.
Yeah, it makes all the difference in the world.
And it's something I have complete control over.
And everyone has control over what you put in your mouth. And even if you feel out of control in a moment, the next time you sit down, the control is back in your core.
Every moment,
and it never left.
Yeah. Brandi, how can people find you?
Great question. You can go to my website, drbrandymoore.com. You can also find me on TikTok or Instagram at Dr. Brandi Moore. And then I also have a podcast that will be coming back in the spring called the Pretty Healthy Podcast. And that is on iTunes, Spotify, or wherever else you listen to your podcasts.
Great. And that's where we first connected when I was on your podcast. And I am so grateful to have you here today. And this has been such a wonderful conversation. Thank you so much for all the work that you're doing and for sharing so much with us today. And stay healthy.
To continue your journey forward, find Jory Rose on Facebook and Instagram to become part of her growing community. You can also gain access to her meditations, books, online classes, or to sign up for an upcoming retreat. Visit her at joryrose.com. That's JOREEROSE.com.